welcome everybody. Thank you so much for joining us. We're really excited to be here. Welcome to another Good Gut Live. For those that aren't aware, my name is James Marin. I'm an integrative registered dietitian, environmental nutritionist.
I'm Deli Marin, integrative dietitian, certified gastrointestinal nutritionist, and we're so excited to have this conversation with Dr. Zach Spiritos. For those who aren't familiar with you, we'd love for you to introduce yourself to our community.
Thank you so much for having me. I'm Zach Spiritos. I'm a neurogastroenterologist. I pay attention to like the food tube, but also the way the tube connects with the nervous system and the immune system and the brain as well. It's a great job.
It's not an easy job, that's for sure. And what's cool, I guess a great place to start is, there's we love gastros, we love gastroenterologists. We hear from a lot of them. A lot of our patients are seeing them. A majority.
We worked in a GI practice.
Worked in it with a gastroenterologist. Not all gastroenterologists are like you. How did you get to where you are? What kind of led you to kind of dig deeper into a lot of the issues I would say a lot of patients aren't even aware of? How did that all start?
Oh, man. So, in GI training, I went to Duke. It's a wonderful program. And, I think we are trained to be surgeon adjacents, where we do a lot of procedures. And, I think endoscopy is incredibly important for colon cancer screening and healing bleeds and strictures and treating ulcers and all these very important things. I think that I saw a lot of chronic conditions or chronic complaints in clinic whereby you'd have all the endoscopies and we just wouldn't find out what's going on. And then you'd lump people into this like IBS bucket, which was horribly unsatisfying because it's so nuanced, right? And so you say like, all right, well, why? Like, why do they have symptoms, right? And so, there's things like, the pancreas isn't making enough enzymes or bile spills out too fast. And those are different conditions. But then there's like truly conditions where people have symptoms that are related to their nervous system or the local immune system in their gut, or how well or like the lack thereof of intestinal integrity, which is called leaky gut, that can't really be detected on imaging. And so I'm fascinated by how this all plays together. And so I've realized that I think to provide the best care for my patients, I had to try to get a sense of like motility, the local immune system, the nervous system, and take all of this into consideration when understanding why someone has symptoms that they do when the endoscopy doesn't tell the whole story.
And we hear that so frequently from our patients, our community members, that they're like, all right, I got the blood test, I got the scopes, I got assessed. They couldn't diagnose me with anything else. So I was just given this IBS diagnosis and just told, go away, go deal with your irritable bowels and, come back if anything major is happening, if you're bleeding. So we love that you're saying, no, I'm not satisfied with that. I want to look deeper. I want to understand what this is. And I think it's being very well received and appreciated because not a lot of gastros are talking about some of the things you're talking about, specifically things like histamines and mast cell activation. And tell us why this came on your radar, how you decided this was going to be where you spent a lot of your time, or when you're hearing your patients speak, what kind of piques your interest where you're like, histamines, mast cells.
So I see a lot of motility issues. So I think everybody in my clinic has gastroparesis. I like gastroparesis a lot. And this was a couple of years ago where I had a lot of patients with like motility issues in clinic. And then a lot of folks with gastroparesis also have POTS. A lot of people with POTS have mast cell disease. And I think that we'd work on their motility through a variety of different things. And then, they'd also be like, well, I stand up and I faint. I was like, well, that's not great. And so I was like, well, we can get you to poop better, but they're still miserable. These are like young women who like are in school and working and are young mothers, and they're completely sidelined by these symptoms. Like, what's happening? And no one had any answers. Like the cardiologist would be like, oh, we did the testing, the EKGs. Like it's kind of like the colonoscopy equivalent. We ruled out ischemic disease, we ruled out heart failure, we ruled out like an arrhythmia. But they're like, oh, well, it's not that. Well, they're so miserable. And then I guess I kept reading to figure out what was going on. And then I started to treat POTS because the local cardiologist, who's amazing, just like was booked out forever. So fortunately, I had some amazing mentors. I look back, my old residency career, I had my old cardiology mentors who, shout out to Alexis Cutchins, who's amazing. but just great, smart cardiologists who work in this space kind of trained me up on this. And then, so we're getting the motility going, and where the POTS is shored up, but these patients all have migraines and brain fog and fatigue and sinus issues and endometriosis and rashes and bendy joints. I was like, what is this? I did not learn about this. And then I came across mast cell activation syndrome, and it's a whole world of I don't knows. Like, we're all just kind of making it up because there's no FDA approved medications for these things, and the preclinical trials are few and far between. And so that's how I discovered it. And now I'm living in this world and trying to figure it out every day. And it just requires a lot of reading and a lot of making it up and duct taping this together, because anybody who says they get mast cell is a liar, because no one knows what's going on. It's so random, and you can read everything. It's still there. There are pieces we cannot connect the dots just yet. It's just infinitely complex. We just don't know a lot about the neuroimmune system.
Mm-hmm.
Yeah, a lot of providers are like DIY era, right? Where it's like, okay, yeah, let's piece this together and figure this out. But to back up, because I know our audience is a bit diverse, where it's like, oh yeah, POTS and MCAS and all these things. But backing up, like, what is MCAS? So mast cell activation syndrome? What is POTS? How is that connected? Kind of maybe, and you can try and defining crash course a little bit.
Yeah. So there's something called the trifecta. Okay. And they kind of run together. Not everybody, but POTS, MCAS, and hypermobility. Okay. So POTS is something called postural orthostatic tachycardia syndrome, which it at the core of it means that there's orthostatic intolerance, where you stand up and you get uncomfortable because there's not enough blood going to your brain and your heart. There are people who have POTS that don't have mast cell and hypermobility. But those who have hypermobility and POTS, a lot of those folks have, for those who have hypermobility and MCAS, a lot of those folks have POTS. But POTS is very heterogeneous. There's a lot of people that get POTS who don't have any of these conditions. So POTS is very nuanced, but these folks, for various reasons, happen to get POTS, okay? They also happen to have mast cell activation syndrome. So mast cell is where these innate immune cells, which are mast cells that live in every surface of our body, but mainly live on the barriers between the environment and our body. So the skin, the GI tract. The GI tract is where the inside of our body samples the outside world. The sinuses, the lungs, the generative urinary tract. Their mast cells are very twitchy. Mast cells are supposed to look out for triggers in the environment and respond appropriately, like fungi, viruses, bacteria. But these mast cells get pissed off all the time at the most innocuous things, like a stressful conversation with your mother-in-law. Shout out to mother-in-laws. I love mine, but that's an example. The wind blows too hard. There's something called the October slide, where people get worse because the weather is changing, the temperature pressure is changing. People get more symptomatic.
Yes.
It is really tough to diagnose. There's not a lot of great objective markers to identify it, so it's quite invisible. And a lot of these folks often happen to have the third arm of this, which is hypermobility.
Mm-hmm.
Is everybody hearing that?
A little bit. It's all good.
I have a 4-year-old. Shout out to all the parents of young kids who have temper tantrums. That's literally what's going on in my household. Shout out to moms who's taking care of that as well and let me do this podcast.
Yes.
Hypermobility, is the third arm of this stool. Hypermobility is where it's a connective tissue disorder, where people are very flexible, but it's a lot more nuanced than that. It leads to compression. Connective tissue is very important in our body. It's supposed to hold us upright, hold our organs in place. But when that's not working as well, things compress and run into each other. It can lead to a whole host of symptoms. So, we think of hypermobility, mast cell activation, and POTS. It's kind of one condition, but people happen to have more of one thing versus the other. Some people have more POTS. Some people have more mast cell, where they get anaphylactic when they walk outside. They have flushing and rashes. And some people are more bendy and have a lot of compression places. So it's something that was given one page of material in medical school, which truthfully requires a whole curriculum in and of itself.
Yeah.
Mm-hmm.
Yeah.
And what do you tell the person who's basically trying to figure it all out? Maybe they've identified they have some mast cell disease, histamine intolerance. They're doing all the things which we'll get into to support those mast cells, but it's becoming difficult for people to find the right providers to diagnose them with some of these different things. So one, outside of including a neurogastroenterologist or gastroenterologist who can help diagnose mast cell disease. And two, how important do you feel it is for them to get diagnosed with some of these connective tissue disorders? Because are there medically tons of resources for them out there that would change the outcome of their treatment anyways, if they got diagnosed with one of these things. I think it's important to know what's going on, but would it change things kind of from a care team perspective?
The first question is, I don't know the answer to that. Who treats it? I don't know, because there's no formal curriculum for this. Nobody was taught how to take care of this. If someone is, they've learned on their own through the scant research that there is. So it is an allergy condition. Most allergists don't know how to treat this or have a very narrow view of what this could be. Because I went to the same medical school as allergists. Like, I didn't go through allergy training, but like, mast cell is it's just underappreciated in literature. It's still thought of as like a TikTok diagnosis. We're like, oh, did you get that? Did you hear about that from this weird GI doctor on Instagram? Like, that's probably made up. Like, no, it's very real, and people get better with therapy. So there are resources. The Ehlers-Danlos Society has a great website. People that in the EDS world are probably at least aware of mast cell activation syndrome. Dysautonomia International has a great catalog of people who treat POTS, and people who treat POTS, like the local cardiologist in Raleigh, he treats activation syndrome to some degree because he sees it all the time. And the local PM&R physician at UNC, who treats a lot of hypermobility, he treats mast cell as well because he sees this a lot. So it's just, you need someone who kind of is in this space. And so I think those are two good resources. And the Mast Cell Society has a website as well. And I think, to be fair, I hate to say it, but like Reddit and like Facebook, a lot of people found me through Facebook because they were like, oh, did you see this guy's like weird post about him pooping on a toilet and like showing people how to put their feet in the right position? And so I think that it's like patients helping patients and being, I had a really good experience with this person. And I wish I had a better answer for you. I think in terms of diagnosis, it's really important at least to like put a finger on what's going on. Like, if you have unexplained symptoms for years that if you've been told is in your head or anxiety and all the tests are negative, do you know how infuriating that is? And to have be able to label the monsters, like, that's why I have this. Like, that's my mast cell. We may not have a perfect answer for it, but goodness, like, now I know how to categorize it. It makes it less scary, and it justifies people's experiences. Like, that's so important. There's so much medical gaslighting and medical PTSD in this world, and I don't necessarily blame physicians a lot or providers. They don't really know what this is. Like, it doesn't make any sense. Like, it doesn't fit into any neat box that we had previously learned about in training. But I think it's really, and then yes, I do think it affects outcomes long term. In hypermobility, if you get a good PT on your team, right? Like, you may avoid like horrible orthopedic things down the road and things that require surgery and labral tears. And, the people, how they hold their body, like people with hypermobility tend to have poor proprioception. They're holding their body in ways that are disadvantageous to their muscles and their joints. And like, you can really prevent injuries down the road. So I try to get a good physical therapist on my team, on our team, early on in the experience, if a patient is open to it.
I love that. It's so important to just empower people and validate what their experience is and provide somewhat of some direction and advice and input and treatment. And what are some of your go-tos that you're like, okay, you've got mast cell, histamine intolerance. What are some of the go-to things you're recommending? It sounds like PT is one of them. What are some other things that seem to be important or recurrent?
I wish I had a good answer for you.
I'm sure you do, because this part's important, like, to get your feedback. I think it's so important to talk to practitioners who are seeing patients on a regular basis, because you can I know it's hard, it's like all over the place, but like there is maybe some trends or things you're seeing
And I love that. That's always the sign of a curious provider, where you're like, there's not one guideline, there's not one thing.
Oh yeah. I've hurt people, right? I put people on therapies that don't work or make them feel worse because we don't know. Like, it's a tough place to provide care. Yeah. But I'm very upfront about patients with this. Like, there's just inherent uncertainty in a lot of things that we do. So where do I start? Okay. I start with validating the experience and telling people like why it's tough to diagnose this and why I often don't send biomarkers, because they're so insensitive to what's going on. So we just say like, all right, I think you have it for XYZ reason. Let's dive into what we can do now. Okay. Number one is the environment. So people with mast cell are exquisitely sensitive to like synthetic dyes, fragrances. Like, I have a patient who's like the electromagnetic frequency from his phone sets off. Like, it's so it's cleaning up the environment, so to speak, not from like a hygiene perspective, but making it more mast cell friendly. So there's a really long handout that I'd be happy to share with you that I've made that just goes over like cleaning supplies and air filters and water filters and shower filters and deodorants and perfumes to see like this versus this versus this. And I don't find that it does everything, but it's like I find that mast cell is kind of like a stress ledger. And when the stress ledger gets too overburdened, people get symptoms. But what can add to that stress ledger? Stress, diet, poor sleep the night before, food, and like the things in your environment. So I think it's just kind of slowly like kind of decreasing the pressure on the mast cells. But it rarely does, but it's part of the puzzle. And I talked about diet. The diet piece is interesting. There's no clinical data behind this, but I've heard over and over and over again that people respond to either a gluten-free diet or a low histamine diet, but it's not for everybody and it doesn't work for everybody. So a lot of these people are horribly restricted in what they can eat. So adding more rules can be counterproductive. So for the right person, if it's right for them, then maybe introducing one of these diets like one at a time for 46 weeks, usually with the dietitian, is helpful. So you can eliminate foods as a proof of concept and then add back things to find that nice balance between symptom control and not being super restrictive. Mm-hmm. Okay. Then I talk about stress. Everybody's got stress. Telling someone to not stress is like the dumbest thing you could tell somebody, right?
Yeah.
But there is a inherent stress with having symptoms that you don't know how to control. Mm-hmm. So some people get a little symptom, a little flare, and then their brain takes it with like, oh my gosh, is this going to ruin my day? Like, can I go take my kid? Can I like read to my kid's school this week? Can I take him to soccer practice? Can I go to work? And that thought pattern can make symptoms worse. And so there are like limbic retraining programs that I find really helpful, like DNRS or Gupta, that have like clinical data behind it. I think that I've seen people really like, for those who especially are exquisitely sensitive to medications, really benefit from. And it's also like, why not? If it's like, and you know, if some people don't like that, like hypnosis or cognitive behavioral therapy, like some way, someone to kind of work you through the thought patterns around your symptoms can be helpful. And then we talk about medications, and it's tough. It's tough. There's a lot of potential therapies out there. A lot of it is trial and error. And, you know, there's not a one size fit all approach. There are certain medications that work better for certain symptoms, like for prominently GI symptoms, like cromolyn, ketotifen can be nice options. A low dose, like a microdose of a GLP medication, I found to be really nice and like really well tolerated, mainly because I think that GLPs are endogenous to our body, and mast cells react to like all synthetics and dyes. When you buy like a medication over the counter, it's not only the medication, but like 8 other ingredients in there. But when you do like tirzepatide, like the GIP and GLP-1 agonists, like they're endogenous to our body. So I find them to be like well tolerated. Actually, dare I say, the most effective medication that I've seen yet. But that's, again, I don't want to put the cart before the horse, because like, I don't want to say everybody, I haven't put an Instagram post on it because I'm nervous, because I don't know if it actually, I have like a very small sample size and I find it to be successful, but there is clinical data behind it. Yeah. So, you know, high dose vitamin C, Celebrex, like, but then you can get immunomodulatory therapies like Plaquenil and IVIG. So really it's like, I can't tell you what to put someone do it. It's impossible to do, and it's disingenuous. You know, but a safe place to start, like antihistamines are a good place to start, because they can, you know, Pepcid, Zyrtec, they block histamine, which is one of the chemicals that mast cells kind of secrete. And there's histamine receptors all over the body, the brain, the nerves, the GI tract, the respiratory tract, the sinus tract. So, you know, quercetin, like flavonoids like quercetin, rutin, luteolin are kind of safe, kind of natural compounds that can be helpful too. But man, everybody's different. And to happen, you need to have someone to work with you to do one thing at a time, listen to your symptoms, and hopefully have a background in treating mast cell to know what works and what doesn't. And you continue to read, because there are new medications and therapies that we are finding out like on a weekly basis. Like, oh snap, like we can use that. Like, let's use that. And then, you know, my algorithm changes every couple of weeks based on what I hear.
Yeah. Okay. This program is not for you if you're looking for a quick fix and you're not willing to put in the work. We have spent years and years creating a program that actually helps you get to the root of gut dysbiosis like SIBO and IBS, but it is not for you if you're looking to get better in just 1 week and something very, very quick. We have made it simple, affordable, and go at your own pace, but you still will be the one putting in the work to get better and truly overcome your SIBO and IBS. Take advantage of the current sale price for the Good Gut SIBO IBS program, because it will be ending soon. get your opinion on something, or see if you made this observation, because we get a lot of patients who are dealing with this and just having all these symptoms, and it can feel just so overwhelming. There's so much going on. I have a migraine, or I'm getting rashes, or, I mean, like you said, there's histamine receptors everywhere. And a lot of the times it didn't happen overnight, right? Like this has been ongoing, or they've been like, I've been constipated since I was 2 years old, and it's been this ongoing thing. Are you also seeing that when you're looking back at past medical history and getting to know the patient and going like, this has been going on for a long time? Or are you seeing those overnight types of things?
I think I see both. Well,
Okay.
so that's very insightful. Yeah. So I love getting into like, when's the last time you felt healthy question? Like, when's the last time you felt good? I love that question. And some people are like, I've never felt good. I'm like, that's horrible. And I think people are born with mast cell, and some people have been reactive and quote unquote sensitive since like the beginning of time. I find that in a lot of folks, it's kind of a slow burn, and then something happens, right? I think there's been a huge uptick because of COVID, and COVID was that. Like, if you ask people when their symptom starts, like 2021 is like, everybody says 2021.
Yeah.
And it's like, well, I've always had things, like I've always had migraines, but they were like migraines. Like I could deal with those. Or like I had heavy painful periods, and like I was put on birth control. But like, that's kind of all right. Or I had like allergies, but like that doesn't amount to anything. It's, allergy. Everybody's got allergies, but then something happens, and then their world gets flipped upside down, and they can't tolerate the things they used to be tolerant of. And there's I'm having a Friday afternoon brain fart, but there's a incredible Claudia. Oh boy, I need to look this up. But there's a philosophy called toxigenic induced loss of tolerance, which I love. That you guys heard of it before?
Yeah.
It's from Claudia Miller. So it's a philosophy. I think she's an environmental scientist. But it's basically like your mast cells are being kind of manipulated by this environment that we've created, the pesticides, the dyes, the toxins, the yada yada, the cell phones, and they get little hits on them over time. And a lot of these hits kind of induce subclinical changes in the mast cells, and then something big happens, whether it's pregnancy, like puberty, like a horrible stressful event, like a loss of a loved one, a vaccine, COVID, a course of antibiotics, a big time surgery, and then everything changes. And I believe in that. Like I see it all the time. So can't prove it.
100%. And I think when people think stress, they really only focus on mental, emotional stress. But as you're mentioning, these stressors can be chemical stressors. They can be physical stressors, like an injury. They can be a myriad of these different types of stressors that really just fill that bucket until those mast cells can't take anymore, and they get pissed off and they start to react. They want that attention, right? They maybe were whispering throughout your life or talking, and then they start screaming after a large event takes place. So I think it's so great that we're speaking about this more frequently now, because I've seen patients experience such tremendous relief and such an improvement in their quality of life the past few years, now that they're properly being evaluated and treated for mast cell diseases, and not only from a dietary standpoint with the dietitian, but from the rest of their care team and from a PT perspective. And so I think it's so wonderful. It's so important. Like you said, we're still understanding it. And, there's so many systems to consider. So that can make it a little bit tricky with prioritizing, like, okay, what takes precedence? Is it the GI system? Is it the liver? Is it the nervous system? Are there other systems that we need to consider? Do you have kind of all right, let's start here. And then let's venture out from there.
Yeah, I mean, I think I let the patient like drive the ship. I said, what do you want to work on today? Is it like, okay, I get full early. I was like, oh, let's explore that. Okay. Almost all these patients have delayed gastric emptying. So is that gastroparesis? Or mast cell can cause like a clinically like indistinguishable picture of gastroparesis, except their gastric emptying test is totally normal, right? And you ask, well, what makes you full early? Is it like a burger, or does everything make you full early? Can you only eat chicken and rice, or are there certain foods that you can tolerate? And then you kind of get into the world of like, okay, what's bothering you the most? Is it due to motility? Is it due to mast cell activation syndrome? Is it due to compression? And then I just kind of go from there. And there's always, when you see a traditional PCP, and they're wonderful, but generally the name of the game is like, give me one thing that's going on today. And then we got to do your cancer screening, we got to do your vaccinations. You get one thing to tell me about. This is like, what are the top 57 things on your mind? So many symptoms. And then, and then there's no way you can, I have long visits with patients, but man, you just say like, okay, we'll take this down today. And to be fair, like you can't do many things at once because people are really sensitive. So you can't be like, well, let's start 3 medications and send you down. And then, there's so many things that potentially work up. So it all is kind of, at what point in time do you explore certain things?
So prioritizing them when the person needs the prioritization and what systems they need to be focusing on the most in their due time. I love that. Perfect. I know you mentioned GLPs and the place that they play or the role that they play and how you've seen them help and improve outcomes and inflammation and tolerance. What do you say to the person who worries about that delayed gastric emptying that GLPs can bring along? Do you see that with a microdose? Have you not seen that in your experience? And how do you kind of answer any of those concerns or questions that someone might have with that specific therapy, if that's appropriate for somebody?
Yeah, all those concerns are so valid. And so the reason I've become so comfortable using them is because I try to read everything about why do people get side effects? At what doses? Does it happen early? Does it happen late? So let's talk about side effects of GLPs, okay? So do they cause delayed gastric emptying? They do. Is it dose dependent? Right? Does it happen? Does it get worse? No, it actually gets better. So it gets worse in the first couple of days, and then it kind of gets better at 2 weeks. All the way better, it doesn't. Okay? So do I put people with gastroparesis on GLPs? I do. Do I love doing it? I don't love doing it, but I've done it enough in people with pretty profound gastroparesis because at microdoses, I find that only minimally, if at all, causes worsening of the symptoms. And if it does, we stop the medication or lower it. But, with anything, it has to be a risk-benefit conversation. So if I have people with gastroparesis and they're having loads of mast cell symptoms, like, yeah, at a microdose, well, I guess let's back up. Like, why does it cause weight loss? Okay, so it blunts the appetite because it's not of the effect on the stomach, but the effect on the hindbrain. So the brain is where appetite comes from, right? And so that effect on the brain is where the decreased appetite comes from, but it also can causes a delay in your gastric emptying. So the appetite suppression doesn't get better, but the delay in your gastric emptying does to some degree. Not fully, but it does to some degree. Again, that is dose dependent. So at a microdose, which hasn't been studied, right? Like I have found that it doesn't delay the gastric emptying at all. I haven't tested like before and after gastric emptying studies, but people don't get any worse on these doses. If it makes you feel worse, it is not forever and it will last for a week and then you can stop. You can microdose. So if I start at, for example, 0.5 milligrams of tirzepatide, where the starting dose is 2.5, if it makes you feel not great, but it's still tolerable, then we'll bring you down to 0.2. And in case series that Dr. Dempsey and Dr. Afrin did back in June on GLPs and mast cell activation syndrome, people started at a dose of 0.2, which is 1/10 of a dose, like an ultra dose. Yeah. So anytime someone brings up those concerns, I am like, you definitely should be concerned about that. And you are asking all the right questions. I will say that anecdotally, I have not seen it worsen gastroparesis, even in those who have already significantly delayed gastric emptying at a microdose. If you try to put them on a normal dose, it will not go well. But I think that at a microdose, it works different. It doesn't have that significant of a delay in the gastric emptying. And the anti-inflammatory properties are independent of the glycemic control and weight loss. If you lose weight and improve your glycemic control, will it improve your inflammation? Absolutely. But a lot of people that have mast cell activation syndrome, it's not because they have central adiposity and prediabetes. Some people do, but a lot of it's not. It's just because they're so inflamed, right? And so that's why tirzepatide is being looked at to treat inflammatory bowel disease, right? If you look at people with inflammatory bowel disease who are incidentally on these medications, they do better than people that aren't on these medications. And it's being looked at to treat IBD. It's being looked at in a study to treat long COVID, which is just an enormously inflammatory condition, right? Like, so there's a reason why people are looking at this, because the preclinical studies show that they're so anti-inflammatory and they heal the gut. Like they help, like when our GI system is under attack, our enteroendocrine cells, which are L cells of our gut, release GLP to help like patch things up. So it's just like, it's pretty like, granted, these are all preclinical like loaded studies, but like, it's pretty cool. It's pretty cool. And I think anecdotally they work. It's like a pretty cool thing. And I hate to I'm waiting for the other shoe to drop a little bit. And I think that they're well tolerated, people with mast cell, because they're endogenous. So I think it's just kind of cool.
And in your sample size, your clinic, what do you tell the person who's concerned with it further lowering their appetite, even at a microdose? Because a lot of mast cell patients already aren't eating very much because they just don't feel well when they eat, or they have so much inflammation. Have you seen that affect appetite? Or on the contrary, have you seen the decrease in inflammation actually enable people to consume more whole foods and tolerate the foods that they perhaps weren't tolerating prior a little bit better with something that decreases their inflammation?
Yeah, that's a great question. And someone who's already so limited, when I broach this subject, it is very delicate, especially someone who's a disorder or kind of that history as well. Like, it's such a tough conversation to broach. I try to do it as honestly as I can. That I think that, well, you have to ask, why are they not eating? If it's profound gastroparesis and they don't have any mast cell symptoms, don't do this, right? But if they eat and they get full really early and their gastric emptying study is rather normal, and they also have brain fog, fatigue, migraines, flushing, it's probably worth it to give it a shot. And I watch my patients very, very carefully, and I say, just keep me updated. And if we start this microdose and you feel worse, we're done. Or we can reduce the dose depending on what your response is. But I find at these microdoses, I'm just not seeing negative side effects. In fact, if you're not eating because you're so inflamed, then it liberalizes your diet to some degree.
Absolutely. I love that. I love that you're observing that in your clinic as well, because we know there's such an interconnected relationship between GI disorders and eating disorders. And I just am looking forward to more data coming out on the role that mast cell disease perhaps is playing between that interplay of those two conditions, and how better managing mast cell disease could perhaps help with eating disorders and these GI conditions that we see so commonly co-occurring and concomitantly happening for people. So I think we're in exciting times. Just in the last 15, 20 years, we've learned so much about IBS, SIBO. Now we're learning more about mast cell disease. So I think the future of GI issues is looking bright for people. And while we're kind of in the midst of it, I know we have a lot of questions.
Can I volunteer something? I just need to scream this from the top of the mountain. If something hurts when you eat, okay, it's not always mast cell disease. In this specific patient population, there are there are compression disorders like MALS and SMA syndrome. They go horribly, horribly underdiagnosed. And it's I see one a day now, and it's a horrendous condition. And it gets misattributed to functional GI disease, or mast cell typically doesn't cause a lot of pain. If food hurts every day and you have hypermobility or POTS, MALS is something you got to think about. And nobody ever thinks about it because it's just, we don't know a lot about it, just like mast cell. And I see it all the time. And I just want to throw that out there because that's something that I just want everybody to be on everybody's differential diagnosis. When someone has pain after eating, that is all the time. You got to think about compression disorders like MALS and SMA syndrome.
Can you tell people who maybe aren't familiar with those terms what they mean, how they might affect their digestion and just their GI tract as a whole?
Yeah, so I wasn't taught about it in fellowship. Maybe there's one page on it, but it was something that's, no one has this. And not a lot of people have this unless they have hypermobility and POTS. And the MALS stands for median arcuate ligament syndrome. And the median arcuate ligament hangs off the diaphragm right here. And it's this sling that lives right above this artery called the celiac artery, and something adjacent to it called the celiac ganglion, which is this nerve bundle. And in hypermobility, it just kind of sags a little bit. It's called ptosis. And it can sit on that artery or those nerves. And so every time people eat, it causes a lot of pain. There's no safe foods. People get, they hurt pretty immediately. It doesn't discriminate yet between foods. When it gets worse, it can happen with liquids. People are often just they hate eating because everything hurts. And people just tough it out. And it gets ascribed to an eating disorder, and people just through it, right? Because it's in your head, it's an eating disorder, just keep eating, you need to eat. And it's no, it hurts. And our diagnostic tests are unreliable a lot. But it's something to be mindful of. And SMA syndrome is where the third part of the duodenum, which is the first part of our small bowel, gets compressed by the SMA in the aorta. It's typically when it just so the intestines are right through this V, and when the angle compresses, it gets compressed. So that typically manifests as pain a couple hours after eating, typically like roughage or really fatty things that are tough to go through. And that can be pretty. It's horrible as well.
Wow. Very interesting.
Super, very, and it's so
Yeah.
important for more providers to be educated on these things because we can chalk it up to, oh, you probably have gastroparesis, right? Because it's kind of similar area, or it's you probably have an eating disorder. So to have more understanding around it and tools to manage it can be life-changing for somebody who has lived a large portion or their entire life with discomfort after meals, and perhaps, like you mentioned, that could have led them into disordered eating or eating disorder diagnosis because they truly just don't feel well. So love hearing about it. It's so important. Our community's loving it. I know we have some questions as well from the community if you are open to answering some questions.
Yeah, totally.
Yeah, we'll do. There were questions on data that maybe you've seen between the connection of mast cell disease and eating disorders with GI conditions.
And I think, we just answered that one. So,
did we get? Yeah, we did a little. Okay, so we'll do the next one. Okay. Please explain how the immune system shifts. Does it become Th2 dominant in conditions like MCAS, or is the condition more like those who are already more Th2 dominant?
More likely.
This needs to be for an immunologist, but from my rudimentary understanding, like Th2, I think is adaptive immunity. And mast cell is more of an innate immunity issue, although it's multifactorial because so mast cell activation is typically an innate immune system issue. Mast cells have no memory; they react immediately to things that are present in their environment. That said, the innate immune system and the adaptive immune system communicate. So you see a lot of autoimmunity in these conditions and a lot of autoantibody production. And it's like, well, is it the mast cells that are so productive that are then making the B cells angry that then cause autoantibody production? Because you see a lot of autoantibodies that may not mean anything. Or you see a lot of like anti-TPO, which indicates Hashimoto's, but like every thyroid is just like quite normal, or maybe just like a little bit off. You're like, well, that's fit. Or is it that mast cells degrade the lining of your intestines that lead to more permeability that exposes your immune system to more outside world things that leads to more autoimmune conditions? That's all to say that I cannot properly answer your question because I am not an immunologist, and I'm really sorry. I wish I knew more, but I'll start reading about it. That's
a good question. Such an in-depth question. Just in your experience clinically, have you seen autoantibodies reduce at all with managing mast cells a little bit better?
I don't follow it. But what I will say is there's a lot of autoimmunity in this condition. Like esophagitis, inflammatory bowel disease, celiac disease. And I have to think, and those I don't find get better when you treat the mast cells. I find that perhaps the mast cell activation predisposes people to that autoimmunity. And once you have it, you have it. And then it's something else that you have to treat, whether it's like, all right, well, now your immune system has been exposed to this thing, and now now it's kind of revved up, and you have to treat that as a side, like Sjogren's disease. Like we see a lot of Sjogren's in this community. We see a lot of kind of mixed connective tissue disease. And then you put people on like immunomodulatory therapy like Plaquenil when people feel better for the right person. So it's very, I don't understand the immune system very well. And I try really hard. It's so complex.
It's so complex.
I think that I will never get it. I just won't. And I'm okay with that. But I try my best because, man, it's so instrumental in why these people feel the way they feel.
Yeah, and we get that all the time where patients, a lot of patients who tend to go more towards integrative providers have that why, where it's like, okay, well, we hit this level, why? Okay, the next level, why, and why, and why. And at some point you're like, yeah, you're not an immunologist, you're not a virologist, it becomes where then you need this interdisciplinary care team that are all integrative, all on the same page. And that's so, so important, where a lot of these patients who are dealing with a lot of these very in-depth issues, you're going to need not one, not two, not three, maybe 4+ providers on your care team that are going to help you with a lot of this. Which question are you wanting to go with? This one? Okay. So let's see.
There's Judy's question about insurance.
Yes.
Yeah, we were saying,
I get this all the time. And I
yeah,
want to say, I don't like taking cash, right? Keeps me up at night.
yeah,
We try to be as affordable as we can. Here's the thing, Judy, is that I spend so much time on the patient portal talking with people. I wake up at 4 a.m. messaging people because this is so incredibly complex. Okay. We have no FDA approved medications for POTS, no FDA approved medications for mast cells. So what does that mean? I am always talking to people. I am on the horn with hospitals to get people like mall surgeries around the world, right? That takes time and I don't get paid for it. Okay.
right.
And if I want to support a clinic and a dietitian, an admin, an APP to see more people, like I can't, like when you go, the reason why hospitals work is because of procedures. Like procedures drive money. GI doctors, cardiologists, surgeons, they pay for the hospital because they are billing like for procedures, and insurance pays a lot for it. If I just talk to someone and prescribe medication and I charge insurance, I get paid nothing for my time. I mean, I get paid some, but not nearly enough to run a clinic. So when you crunch the numbers, it's the only way to be sustainable. And for all the time that I put into a patient, whether that's always responding to messages or coordinating care across multiple states, I get paid for none of that, right? Unless you run like a membership system where you're like, all right, you pay for this and then I'm yours. I'm like, I got you. Like I'm your ride or die. But without that, I can't, insurance they won't pay us anything. And so I hate doing it. And we get messages every day being like, this is too expensive. And I get it. And I wish we could do it a different way.
There are lots of gut powders and gut supplements out there, but hopefully this quick analogy will help you choose the right one. When it comes to gut supplements and gut powder, think of your gut as a garden. And in this garden, you can plant seed, you can transplant plants, or you can also facilitate healthy soil so things will naturally grow. What we opt for and what we recommend on a daily basis when it comes to taking a gut supplement is to opt for the supplement that will help the soil be healthy. This is essentially a compost for the gut. This helps ensure your gut soil is healthy, your microbiome is thriving with your own personalized fingerprint in your gut microbiome. If you're taking probiotics and not sure what they do, it's like transplanting plants that belong in tropical South America to Alaska. Sure, you can do it, you can spend money on it and time on it, but it won't last long. Instead, ensure that your soil in your gut, which is the gut structure and gut function that you uniquely have, is ready to facilitate healthy seeds, healthy probiotics coming from your environment, from your food, and so on. That is why we formulated Gut Nurture.
And we know insurance is so highly variable. I always say the insurance system is kind of like taxes. It's like you just make your best guess of, how much you owe. If you get it wrong, you're in trouble. And, it makes it really difficult, like you said, to run a dependable clinic and provide that very thorough care when it's insurance only. So whether it's hybrid, whether it's a cash only practice, a lot of those who really, really subspecialize are going that way at this time for that reason. And then, utilizing the services that the insurance perhaps does cover can be helpful. Like go to your PCP for this, or go to, the specialist for that, go to a functional gastroenterologist to just get your scopes and use your insurance for that. And then get the specialty care outside of that, where you'll get that proper time allotted towards you. You'll get more thorough care and hopefully walk away feeling like it was a great investment.
Yeah, this is an area where it is a little bit the DIY, where there are those loopholes where you can be strategic in helping your patients a bit with their insurance, but generally, yeah, this goes into quite the rabbit hole of what insurance is made for, the structure and how it's designed. It is a bit designed, especially if you're talking about state and federally funded insurances. It's designed for those practitioners to be a mill. You're double booking, triple booking, you're seeing patients, a quick, here's your prescription, I got to get out of here because I have my next patient. It's not designed for integrative, in-depth care. And so we have to, this is a massive problem for sure, which is
I love Judy.
Yeah.
We love our Judy.
Yeah.
Judy always brings
It's a great question. And also like dealing with insurance is such a headache, and they always change the rules, and you have to have a whole team to like keep on top of claims and like how much they reimburse. And like, it's like my wife and myself, like it's tough to do. It really
Absolutely.
is.
So we welcome any new ideas anyone has of making it work, and hopefully we will continue to find ways to make it work. Absolutely.
Yes.
But in the meantime, we'll continue to niche down and really provide as much thorough support as possible. We have another question that was pre-submitted. Someone's asking, since we know medications like NSAIDs can cause irritation, breakdown of the mucosa, the protective mucosa in the gut, someone's asking, what are your favorite prostaglandin inhibitors that are gentle on the stomach? What is your suggestion for somebody who needs to be on an NSAID for an injury or something ongoing? Are there any that you like to suggest, or any other more helpful compounds or natural therapeutics that you use?
Yeah, so I don't use NSAIDs a ton, but I will use Celebrex every so often. I mean, it could be used for osteoarthritis. There's also some mast cell flares look like thermodysregulation, where the people get really hot and sweaty, feels like hot flashes, a lot of joint pains and brain fog. Celebrex can be a really nice break glass in case of emergency, and some people take it every day. The question is, like, what are we worried about, right? And so we're worried about creating gastropathy or like a peptic ulcer. You just gave a smiley face. I'm glad. I wish I hate that answer. I wish I had a better answer for you, but I'm glad that was, somewhat sensible. In any event, and so you always, like, every medicine is a tool, right? So it has to be for a good reason. And so if someone needs NSAIDs for like horrible osteoarthritis and they just can't get surgery, or like, that's just like, there's nothing else, because like NSAIDs hit, like they are just like meloxicam for like a bad injury is awesome, right? So what are we worried about? Okay, so who gets peptic ulcer disease? And those are typically people in their 60s and 70s. Not always. 60s and 70s, smokers, alcohol use, H. pylori. And so if someone is in their 5th, 6th, 7th decade of life, I will, if we're using like an NSAID, hopefully it's for a finite period of time, like a PPI for a finite period of time can offer gastroprotection. And PPIs, like everything else, aren't perfect, but they're really good at protecting the stomach. Like if someone has a peptic ulcer, you heal it with 8 weeks worth of a PPI. And so I would, if you need a hardcore NSAID and you are in a higher risk group for ulcer disease, then I would, using it with a PPI at the same time at the lowest dose possible, like Protonix 20 milligrams a day, where over a short period of time won't have long-term detrimental effects to like the microbiome or nutrient or vitamin deficiencies either. But I try to avoid them if you can.
Yeah,
absolutely. I love that. So use the Band-Aids where they're needed, and then take them off after they've served their purpose.
And we always say this, we're a broken record, I know, for our patients, where it's like, you try to take the good from Western and functional and integrative, and we're trying to use the best of it all to piece together for the patient and individualize it, customize it. So I love that. Another question, and we'll see what we can get to, but does mast cell disease damage organs?
Does it damage organs? I guess that's an interesting question. Like, you'll see like LFT abnormalities where the liver gets irritated from it. You'll see like lipase elevations from the pancreas or the stomach, but I wouldn't say it causes like end organ damage. Like, it wouldn't cause like end stage renal disease. It wouldn't cause like hepatic cirrhosis. I don't think it causes like dementia. Like, I don't know. Like, I don't think we can study that. Like, does it cause Alzheimer's disease? Like, I don't think so, right? Like, I don't think we have that data. I think of this as more of like a morbidity as opposed to a mortality condition. So it doesn't necessarily, for few people, it can really, you can be hospitalized for weeks on end. Like, and that's the rare case. I think that's the extreme. And I've certainly met people who are just horribly affected by this and they just can't leave the hospital. But for the most part, it's a morbidity condition. So it's affecting quality of life and symptoms, but not necessarily putting people on dialysis or leading them to like an organ transplant or anything like that. So, I don't think it leads to cardiovascular disease. Like, we know like inflammation can lead to cardiovascular disease, but it's this kind of inflammation. Like, I don't know. I don't think we can say that. So I think the answer is probably not, but it remains to be seen.
Okay.
Love it.
I love that. We have another very interesting in-depth question. Why do some with mast cell disease experience tremor-like movements, or is that something you've observed in your patient population or just clinically? And if so, why do you think or know that that's going on?
Yeah, I definitely think it can cause like a myopathy where you have like weakness that is like episodic. But I'd also caution someone to say that like a tremor is just due to mast cell disease. Like, if you give me someone who has mast cell and hypermobility, maybe POTS, like, you have to ask, like, is this like craniocervical instability, right? Where you have like compression of the brainstem by the cranium. Like, is this some people, if they have like ME/CFS, they're not getting enough blood to their muscles. So maybe it's like a blood distribution issue, which you can see it's, a form of dysautonomia. So, I can't say why. The best answer I can give you is that mast cells live everywhere, including the nerves and the muscles. So you can certainly get like, myotonic twitching. Like some people get like restless leg syndrome when their mast cell flares up, right? And so is that a nerve issue? Is it a muscle issue? All I can say, mast cells are ubiquitous and can cause all of these things. But you also, in the context of like dysautonomia, blood flow issues, like nerve compression from like from the hypermobility perspective, you just have to kind of make sure it's not something else either. And just, I wouldn't say like, okay, just throw Benadryl at it and it'll get better. I say that tongue in cheek. Benadryl doesn't cure all maladies, but it is yeah.
Love it. Yeah. We have one more. Thank you. This is for me. If you could put together kind of the most stellar mast cell disease team, who would you recruit for your team, or like what disciplines, what types of providers?
The mast cell Avengers?
Yes, absolutely.
Are we talking about like individual human beings, or like kind of
practitioner types, practitioner disciplines.
Specialties, disciplines, yes. Yeah.
Okay. So I think you need an autonomic specialist. Because a lot of people have dysautonomia. You for sure need a physical therapist. You got to throw in the pelvic floor therapist as well. Everybody's got a tense pelvic floor. A dietitian, like love me a good dietitian. I think a psychologist, like a chronic illness psychologist, or someone to work on like retraining, exposure, like all of those things. Like a really good clinician. I don't think it has to be like a specific clinician, but someone who can kind of put together the pieces of like what's driving what. Like, is this more a mast cell issue? Is this more a compression issue? Is this more a dysautonomia issue? I think that's a good start. And then like, man, you probably need a really good, I don't know, hopefully never a neurosurgeon if someone has cranioscervical instability, or, a colorectal surgeon, but there's always like the random thing that comes up, or urogynecologist. But but I think that's the core right there.
Love it.
Do you want to try to get, Judy had another question pop in. I love it. Is overall body itching more indicative of histamine intolerance or mast cell activation syndrome?
I think it all depends on what causes the itching. So histamine intolerance is usually where people get an overload of histamine from what they're eating. So it's impossible to like rid your whole diet of histamine, but it's just your body is just taking up all that histamine and causing a lot of symptoms, whether it's brain fog, fatigue, palpitations, itching. But if that whole body itching occurs independently of what you eat, then it's probably more of a mast cell issue, where it's because mast cells are not only perturbed by the histamine that you eat in your body, but also, if your mast cells are angry when you get stressed out, like when the weather changes, when you buy that new clothing that has like that kind of weird powdery stuff on there that's synthetic, when you walk into Bed Bath & Beyond and all those scents like bombard your system, like so it all depends like what is driving the itching and like in what context does it develop.
When it's food related, how confident are you in some of the digestive enzymes or the enzymes that are out there, like DAO, that somebody can take over the counter when they are eating a high histamine food or having a high histamine meal, especially since you said, 4 to 6 weeks should be kind of the trial elimination? How confident are you in recommending those for people to reintroduce histamines into their diet?
Yeah. So the enzymes themselves are perfectly fine if that's the issue that you have. And so it's definitely worth a shot. I've seen it it help expand people's diet and their menu a little bit. I wouldn't say it's like, if you generally just have histamine intolerance, I rarely see just histamine intolerance. I generally see kind of the more mast cell issues. But if it's truly just histamine intolerance, like it could do a lot for you, in combination with trying to be mindful of eating a low histamine diet. But in someone with kind of full-blown mast cell activation syndrome, it's another tool. Like it can, sometimes it's a dud. Sometimes it really can help expand the menu. But it also is expensive. Like it's like $40 a month. And so I don't like commonly recommend it. Like I never say, I think I recommend it like twice today. So it's just kind of, if someone's like doing quite well with their kind of body-wide symptoms and we're like really have a good grasp on things, but like, man, I just really want to be able to eat that like indulgent charcuterie plate with dinner, then like maybe that DAO enzyme before eating would help move the needle a little bit.
I love it.
Perfect. I love it. And knowing everything you know, Dr. Spiritos, what are you doing in your own life or for your kids and your family to even, I know it's hard to say like prevent, but like, let's say bolster, protect the mucosal lining, protect, a healthy kind of gut immune connection, all of that. Any tips you'd give in your own life?
Yeah, no, my kids eat chicken fingers like mac and cheese all the time, and that's an us problem. We're going through a rebellion stage against eating anything green, and it breaks my heart. So I can't say that like you also recognize like doctors are like the worst patients. So I don't know, I'm like the perfect person to answer, but like I think we do a pretty good job of eating whole foods, getting outside, going on hikes, like prioritizing sleep. We try to like minimize alcohol intake, right? Like we know the things. I think people generally know the things that they should be doing. We also like try to get like the plastics out of our house. Like I don't know if that does a lot, but I think it's probably important. Like it hasn't been studied, and I'm a bit of it like a nerd and beholden to data. Like I like to see, but you see these microplastic stuff and you're like, okay, like this is an easy substitution. But like my son, all things being candid, like I think he may have a flavor of mast cell. Like he's really itchy all the time. He's kind of these bizarre symptoms. Fortunately, like men are a little bit like they're protected somewhat with testosterone, not always, but so that has informed a lot of our decisions to go more organic with shampoos and soaps and things like that. But everybody's different, right? Like, but I think it goes back to the basics of like stress management, whatever that means to people, like listening to good music, getting outside, spending time with your loved ones, like eating whole foods, getting good sleep, like hugging your kids, like hugging your spouse, telling people that they love them, that you love them, like small things like that. And then, like making your house more like mast cell friendly, I suppose, like getting the plastics out and getting the synthetics out, like, but also like, I'm not sure our phones are good for us. Like, are we supposed to be podcasting? Is that good for our system? Like, probably not, right? So it's a barrier, but it is a balance, right? Like, I think people move to different countries and they feel better because they get away from all of this, but we're also human. I love my phone. I watch sports on my phone. Like that's not like I'm not perfect because we're also human. So it's trying to strike that perfect balance for you.
I love it. That's where I nerd out in the environmental, the exposome elements. I have some studies up on my tabs too of like really cool studies I want to read. But I love this. This is so great. For those that want to connect with you and find you, where can they do so? Where are you website wise, on social media? What does that look like?
Yeah, I am available on Instagram at Dr. Zach Spiritos. We also have a TikTok account and we have a Facebook account as well. Our clinic is named Ever Better Medicine, where we address kind of complex chronic GI symptoms that may have previously been unexplored or unexplained. We treat dysautonomia of all shapes and sizes, including all the complications that come with hypermobility and mast cell activation, of course.
Very cool. We appreciate you so much. This has been we could probably go another hour.
We just grilled you for an hour.
Yeah, we just grilled you. A nice conversation.
You get back to your balance, your weekend, your time of hopefully de-stressing, whatever that
going
looks
outside.
Like for you. But thank you. We know that this was so insightful for our community. We're all about helping people heal with each meal, and we think that these tips and tricks and insights that you provided will help them along that journey. So thanks so much for spending the last hour with us.
Thank you, everybody watching the Good Gut Live podcast. Again, this episode is live right now, but you will find it wherever you listen to your podcast. So thank you for listening. Thank you for Dr. Spiritos and everyone watching, all of your questions as well. We really appreciate it. Until next time, deal with each meal and heal with each meal. See you next time. Bye, everybody.